I'm Dr. Wong Boy. Actually, I'm a parent club founder. I handhold the parents through the journey from pregnancy to delivery to postnatal. But because I built up a very strong rapport, I have often all the parents, even up to very many years older, even up to 16 years old, parents still actually get in touch with me with some advices, especially on skin rash and allergies and things like that. So I work very closely with the doctor. I may give them advice, but if I feel with years experience, I'll say to them, go and see your doctor, and then it's better to further confirm. So that's important because we work as a team. Eczema is again very common in Singapore, and even right from very young, about ratio again is 1 in 5. And then eczema can, later we'll talk about hereditary. So it's very important, eczema is just an inflamed skin. Alright, and it becomes very, very raw and can be very itchy, and it can then maybe tend to scratch on the, especially younger children, not to scratch, and it becomes blistering, then eventually can become thickened out the skin. So it doesn't look that good. Often it's on the face. It can be attack any part of the body, but usually it's on the face for younger children, and also near the joint, near the arm, inside the elbow, inside arm, and also at the behind the legs. So at the ankles as well. So any part sometimes can be due to contact exposure, sometimes can be due to diet related. So again, management itself is good to actually confirm by a specialist, have a proper plan on treatment of itself. It's mild form, even breast milk, sometimes people say you can even pull a bit. It will clear because breast milk, you can use that. But severe cases, again, you've got to keep it cool, keep it clean. At the same time, use very mild soap. You can soak the baby if it's the whole body got eczema. Soak the baby in a bit of oil, bath oil, inside there for 15 minutes, recommended by your doctor. And usually at night, the children will wear these mittens to prevent scratching. At the same time, very important, you also in very severe cases, there are some medication we can use, like antihistamine cream, or even worse is cortisone steroid cream. Because cortisone cream, again, because it's thinning the skin, so parents are very worried. They always ask me, shall I apply? Doctor, give this. I say, just apply when you have severe, episode. Once it's clear or become a bit manageable, just reduce it. That's fine. Again, parents' education is very important. Well, there are many types of food sometimes can trigger off, especially when you're first starting to wean the baby off to solid. So it's always give very small amount and then give one type at a time because the child may show allergy reaction. Alright, it can actually trigger off like even the asthmatic attack. The lips can swell out, the airway can narrow down, which is very important. We have to be careful. And the baby come with rash. Right, and it can trigger off, sensitivity. Anything eczema is reaction to sensitivity. So it's a form of immunological, reaction. So therefore, again, certain food, especially shellfish, we have to be extremely careful. All right, they seem to have a high chances of trigger allergy. At the same time, also certain nuts, tree nuts and things like that, even followed by what we call milk, and also like soya. So a lot of things can be simply allergic to, even simple things like wheat. Every child is unique, and actually they will react to different food. So as parents, we always try them out. Doesn't mean that you don't like this food, you're allergic to this food, and your child likely to be the same. No, it's unique. So therefore, I will give small amount. Again, let the child have a variety, and then let's test it out from young. And as they outgrow it, they will outgrow it all. There is a built up their own immunity. Goat's milk, by research, they say that it's less allergy. So when talk about the growth status to be similar to other form of milk. So therefore, the only thing the difference is, the baby's poop. Actually, the bowel action is much better, it's softer and easier to pass. And that is different. Most of the time, compared to other form of formula, the composition almost similar, except the MCT. And they found that it's slightly, higher in content in goat's milk.